Chiari Malformation. Chiari Malformation comes in 4 types. There's type 1, there's type 2, being a type of spina bifida usually leaving the person in a state of paralysis, and type 3 and 4. Both have an extremely high mortality rate, usually at birth or in early infancy. It's important to note that all the types of Chiari malformations don't have a huge connection with each other than the doctor who discovered and explained the conditions, Arnold Chiari. However, this video is focusing on Chiari Malformation type 1 and the Chiari Decompression Surgery following. Chiari malformations are usually caused as a result of a genetic mutation or a maternal diet. The intended bony structure in the skull to fit the cerebellum part of the brain is abnormally small. As a result, pressure is placed on the cerebellum part of the brain, blocking the flow of the cerebral spinal fluid. The cerebellum is forced to grow out of the foramen magnum cavity, a cavity usually preserved for the spinal canal only. These protruding cerebellum tonsils grow out of the spinal hole. Usually symptoms of Chiari malformation will peak at late 20s to early 30s. Symptoms may include, but not be restricted to, headaches, neck pain, numbness in the limbs, pins and needles in the limbs, dizziness and loss of balance, vision problems, speech problems, breathing problems, ringing in the ears, muscle weakness, slow heart rhythm, difficulty swallowing, and poor hand-eye coordination skills. Before surgery, a spine MRI will be done for the surgeons to plan an approach to their surgery. The MRI will also be looking for scarring in the thorax, which will require removing during surgery. Chiari Decompression Surgery. The surgeon will make an incision approximately 10 centimeters of the back of the neck/skull. He will scrape away the muscle and the skin, exposing the back of the skull and the top of the vertebrae. The surgeon will then remove the suboccipital craniotomy portion of the skull to expose the cerebellum. A laminectomy will be done to remove the rear portion of the C1 vertebra. Once this is done, the surgeon can open the cerebellum, making an incision which will relieve the pressure on the cerebellum. Once this is done, the surgeon can open the cerebellum, making an incision. The surgeon will then sear off any protruding cerebellum tonsils. Once the pressure has been released off the spinal canal, the dura, or a so-called skin graft of sorts, is used to cover the cerebellum incision, sealed with a special sealant to prevent the leakage of the cerebral spinal fluid. Well, I hope that was an informative video for you guys who are following my vlog. You know that I'm going through this whole Chiari malformation. I thought it'd be a lot easier just to make a video on there, chuck it up so there's a bit more understanding as to what exactly this deal is. So over the last 12 months, before I started this treatment, I had this phobia of needles. I would faint when I had a needle put into me. I had this claustrophobic fear of getting into CT machines and even just seeing my own blood, but going through the processes over the last 12 months, I've kind of been desensitized to it now. I quite happily watch it. So I'm actually thinking about watching an actual surgery of the Chiari malformation. If you're interested in seeing me watch that and see a reaction, comment below and I'll make that video coming up. Otherwise, thanks for watching. If you like what I'm doing, subscribe, hit a like, and you can see how this surgery goes for me in the future. Alright, out.